Really, this is what this is about is Health Outcomes Observatories launch event. So it's quite a big occasion for the project. My name is Elaine Cruikshanks. I'm a founding partner in Acumen Public Affairs, and I'll be moderating the event today. On behalf of the project H2O, I want to thank you all for being here with us, and also to the outstanding speakers who I'm looking forward to hearing about, who will highlight what needs to be done to unleash the full potential of health data. As you might already know, H2O has launched observatories in Netherlands, Austria, Spain, with Germany and Denmark to follow. And we'll be hearing from those projects during the day. We also aim to commemorate these launches and raise awareness about H2O's potential to mark a turning point for healthcare systems. During the next few hours, speakers will present the potential the project H2O holds for national healthcare systems and how H2O can bring the European health data space to life. The objective of these presentations and roundtables is to provide a platform for discussion between different stakeholders and understand what are the benefits for patient-centered partnerships and the role of data going forward in healthcare innovation. It's quite a full day. We're going to kick off in a minute with an opening address from Tanja Stamm, who's from the H2O initiative, and she's a co-lead, along with Anca Toma from the European Patients Forum. And she basically, with her, will address some of the issues around empowering a new era of precision data. Our first roundtable discussion will then follow, and there H2O observatories speakers from Spain, Germany, the Netherlands and Austria, together with Anca Toma representing patients, and Yasmin Diaz-Guichot, who's the lead of healthcare systems transformation at the World Economic Forum, will discuss how H2O can be integrated into healthcare systems future, and will present the future potential of the observatories. Just to say now that there will be opportunities to submit some questions, both for people in the room and online, and this will be done via Slido. And I think there's a QR code that you can access as well as a link in order to do that. So get your questions ready. Before the second, then we'll have a sort of a chance in the second roundtable after lunch to look at patient-centered partnerships, bringing the health data space to life. And representatives will join us from the European Commission online, European Parliament, European University Hospital Alliance, European Patients Forum again, and H2O observatories. And in that session, we're hoping to explore how H2O can bring the first practical demonstration of how the European health data space can meet its full potential and improve patient outcomes, increase data flow, and build more sustainable and efficient healthcare systems. So big challenges, but big opportunities ahead. And then we'll have two more speakers to round off the day. One presentation will be given by Andrea Pacino, who's a partner and founder of Stratege and organizer of the Healthcare Data Innovation Council. And he'll take us through the benefits and challenges of federated patient data, which is quite a challenge. And last but not least, to an inspirational high note at the end, we'll have Tim Hartford, who some of you might be aware is a behavioral economist. He's very frequently on BBC Radio and a TV presenter, and he's an award-winning journalist also with the Financial Times. And he'll be giving us some of his views on the potential of health data and why it needs to be unleashed. So a very varied, interactive day, we hope, and one full of promise for the future in terms of what health data can bring to all of us, and will mark, if you like, the launch of what is quite a momentous project helping the European health data space come to a reality, which will help all patients around Europe. So I'd like to now pass the floor for our opening address to Tanja Stamm, Head of Section for Outcomes Research at the Centre for Medical Statistics, Informatics and Intelligent Systems at the Medical University of Vienna. And she's H2O co-lead. And she'll be accompanied by Anca Toma from the European Patient Forum, and they're going to address how artificial intelligence driven by data can change healthcare landscapes. So over to you. Would you like to join me on stage?
So thank you very much, Elaine, for the kind introduction. Whereas Anca, you will stay there for the beginning. Okay. So welcome everyone to our launching H2O observatories event in Brussels. And it's actually about the national observatories. And like we always do with national things which affect Europe as a whole, we do the event in Brussels. And I think it's probably something where we really can celebrate what we have achieved in our project. But I would like to first start with, and we do that always in Austria, that we welcome the important people in such an event. And I would like to say a very warm welcome to Mary Stuliado from Takeda, who is the industry leader and the project leader. Then we have Angelica Valente from IMI, and I think it's very great that you could join us here for today, and we are very happy that you have accepted our invitation, and we said that it's easier for you to come to Brussels-based events, so we have to do more in Brussels probably to involve you more in the project. Yeah? And I also think it's lots of important people here. It's like always a little bit like the H2O family that meets now and then for some family celebrations, like we said last time when we met in Basel. And it's very nice to see everyone again. And also, I think it's always a little bit of an extension of our family. So I would like to give a very brief overview on why we need H2O and what it really is. So a little bit of the H2O story, and then a very short introduction to the governance model, which I think is very central to what we do here. Yeah? So why do we actually need it? Why did we start it? What is the gap? And I think, and it has been said already also by Elaine and by some other people when we had the talks really prior to this meeting, we are moving into a digital, into how to say digital times. Yeah, so everything is digital, and data will be very important in the future. And I think it should not be data as such, but data should make our life easier. It should make our life better, maybe, and also it should improve healthcare, and most importantly, outcomes in healthcare. And that is actually what I think is really missing. So at the moment, we do not really have data, and that affects, of course, science. And I'm a scientist, and I'm, of course, very interested in looking into different outcomes data. But it's not only science. It's also that we do not have data in healthcare, for example, to improve really patient care, yeah, to improve the communication between patients and clinicians. And we still have fragmented data landscapes, so everyone measures different things. Yeah, we do not have a unified framework really for data collection. And in outcomes research, especially patient-reported outcomes are very important. So we are not only interested in the clinical outcome, but we also want to know how the patients are. And I think there's also a big gap because right now there is not really a unified framework for collecting patient-reported outcomes data. And that's what we want to address in H2O. So the idea was first to standardize what we want to measure. And we have done this in the first 1 year, 1.5 years of the project. There we have focused on 3 disease areas. One is diabetes, the second one inflammatory bowel disease, and the third one cancer. And we have standardized with lots of stakeholders involved, with patients, with people from authorities, with clinicians, with researchers, with the people from the industry sector. Yeah? What we would like, what should be measured. Yeah? We also looked into what is existing. Yeah? So we partnered with ICHOM, who really have a big track record, I think, of developing such core outcome sets. Yeah? So that is already done. And we are now in the phase of implementing these core outcome sets. So the idea is to unify what is measured everywhere. Yeah, basically, we have a, how to say that, an approach to go beyond Europe even. Yeah, but we have started in 4 countries, and you can see them here. So it's Spain, Netherlands, Germany, and Austria. And in those 4 countries, the aim is now to implement the core outcome sets and also to establish an observatory, yeah, a new legal entity. And we have already succeeded in 3 countries, and that's why we are here today to celebrate this. So observatories in Spain, in the Netherlands, and in Austria have been already set up. And Germany and Denmark is not here on the screen because that's the original governance model, but our approach in H2O is to scale this up to more countries and also more diseases in the future. So we have onboarded Denmark already, and Denmark will establish the pan-European observatory, but also a national one. Yeah? And that will be done in the future. And the third part of the project is really to make this data accessible for research, but also for the patients, yeah? For individual for the improvement of the individual conversation with clinicians, for example, so that patients can really see how they have been doing, show this to the clinician, and this can be also used during the clinical visits. And for this, and I think probably in all of the stages of the project, we really need a very thorough governance model, because that's what everyone says. Yeah, it's no use just collecting data and then we have lots of different data sets, but we need someone who really thinks of how this can be shared, and everyone who has a legitimate interest, all the stakeholders should have a saying in this. Yeah, and that's why we have established our governance model, which actually importantly involves patients. Yeah, and I think this is really new. Yeah, so I had a discussion with a clinician yesterday, and I think I could convince him that we need patients in all research projects really upfront, yeah? And we have to involve them and see their perspectives in order to really do something which is important, not only for research, but which is really usable and important to patients as well. Yeah, but we also need the authorities in here, so we all work together, yeah, to make healthcare better. So I think authorities, for example, a very important stake here, and they need to be involved, and that's also will be done in our governance model. We need the people from the private sector, we need the clinicians, and we need, of course, research, and we need society as a whole. Yeah? And the idea of our governance model is to give representation to all these stakeholders and to find some kind of consensus how we can share the data, the health data in the future. And that, I think, is also important, that it involves a lot of safety and security issues. So it cannot be that we can just share any health data of someone with anyone. Yeah? But there's a lot of different considerations of safe spaces where data could be used to do some analysis, but where people cannot download everything and look which disease their neighbor has. Yeah? So this is not the aim, but we would like to make this data really available. And I think that would be really important. It's really missing at the moment. And especially from a scientific perspective, I think we have not enough data to really answer proper clinical, epidemiological, public health questions on outcomes, and that need to be done really in the future. Yeah. Saying this, I would like to ask Anca to join me here on the stage. Anca Toma is the Executive Director of the European Patients Forum. And please, Anca, I would really like to know your perspective on how this all can be valuable from the patient perspective.
Ooh, in many ways. Thank you, Tanja. Good morning, everyone, and thank you for having me here representing the European Patients Forum. EPF is a partner in this project, and I have to say, in the last few weeks, as I was preparing for this launch, as I was sort of trying to dig deep into this project, I became more and more excited, because it represents exactly what our community as patients need to see happening to improve individual health, to improve individual information and knowledge, but also to improve policy and practice. And this governance model that Tanja presented is really reflecting of that striving for fundamentally better health. And well, since forever, we at EPF, we have been advocating for a healthcare transformation that really delivers on patients' needs, on populations' needs, really, because eventually we all become patients in some form. And this, the way this is organized, to me, it says, yes, we measure outcomes to deliver on needs. We measure what's being done so that we can better meet patients' healthcare needs. We better deliver on information. We better deliver on data. We better deliver on standardized, on compared, on ethical collection of data, on ethical sharing for informing patients, for making them, for empowering them to be better partners in their own health, for informing practitioners on what matters to patients, for informing science on what the next step has to be, what works, what doesn't, what needs to be improved, for informing policymakers on the interventions that do work at a community level and on aggregate data. So again, data is everything, information is everything, and these observatories have this fantastic promise of delivering data, information that is fit for purpose, and the purpose is health. The purpose is outcomes. The purpose is quality life. So yes, exciting to be part of it, exciting to be here and getting to know this community, to be in the company of very, very committed people on the science side, on the industry side, and on the patient side. And I'm looking here at my colleague Valentina, who has been leading the work together with Ludmil on our side and the rest of my team who are watching us online. Hi, guys. So yes, very valuable at the individual level, because an informed patient is a better partner for healthcare providers. Useful at community level, because we can compare, we can contrast, we can learn, and very, very useful for advocacy, because then patient organizations like us and our members can go and say, hey, Netherlands, Spain is doing this better, because look at the outcomes, and what can we learn from that? Because at EU level, at the pan-European observatory level, we can really see a lot of data. It's also good for patients, because our community is a central part of the governance, because we have an equal seat at the table along with policymakers, with manufacturers, with scientists, with carers, with information providers. So I don't know what to say. Keep this up, because it looks really, really good. It has a lot of promise, and the road is long ahead, but I really, really do believe it's going in a great direction for patient outcomes.
Yes, thank you very much, Anca. Yeah, thank you very much for sharing your view, and we are very happy that EPF is a partner in our project consortium, and I think there is a very good collaboration in all levels of the project. That's what was said from the beginning, that we need patients really in all levels of the project. And I think what is probably also important today is that we focus really on the national observatories also, because that is a very important cornerstone in our project. And also at the level of the different countries, there's lots of patient organizations involved. Yeah? And I think this is really, really very important. Yeah?
Yes,
and like you say, it's an equal seat on the table. So it should not be that we as researchers just ask patients for their perspective, but it should be really patients being in the decision bodies. Yeah? And I think this is also something what is represented in our governance model, and that is very important, will be even more important in the future, and even more important when it comes to data governance.
Absolutely, and the national observatories are the closest ones to the actual patients. Yeah. That is where the first magic happens. So so absolutely, that's where we have to start.
Yeah. Yes, thank you very much. I think we also should kind of focus a little bit on the country teams today, and there will be more people talking in the panel sessions from the different countries. And a lot of people also have come here to Brussels, which is very nice. Yeah? And I think we have established very, very effective country teams. Yeah? And that has really proven to be one of the important aspects in how the project evolves. Yeah? And we decided recently to even give more resources, more attention to the country teams, because all these national activities are very, very important. And in addition, we need to see, like it's here on the slide, so the pan-European perspective, yeah, that we do not do separate things in the countries, but it's really one picture, yeah, one way of collecting data. And that I think, and that also comes to our next presentation then, when we will talk about AI, yeah, artificial intelligence. We have a lot of good methods at the moment to analyze data, yeah? But the problem really is that we do not have access, and also there in some areas, and especially I think when it comes to patient-reported outcomes, there is not really the data, yeah? And that's why I think we need H2O, because we have to implement a structured, standardized data collection, and then we can also have this data and use it really for all kinds of different models of the new approaches, how bigger high volume data can be handled, yeah, how we can improve really with prediction models, with ways of determining a better point of service in time and space and location for the patients. Yeah, so, and for all this, we need the data. And I think H2O has always been some kind of transformative project. We want to revolutionize healthcare in the way that it's more data driven, and we have seen that in many areas. And I have worked for a very long time in rheumatology, and also there is a lot of evidence that data driven approaches in clinical practice lead more quickly to remission than when you do not use this data. Yeah? So we all know that it's really important to base our decisions on data, and I think the basis for this we want to establish in this project. Yeah? And from the beginning, we have focused also on sustainability. And I think there will be also a little bit more to come later. But the idea is not to finish this, yeah, and I don't know, close down all the observatories after the project has ended. But we would really we said in the beginning that we would focus early on already on sustainability and data collection. Yeah, so it will not be talking about how to do it, but we will really do what we proposed, and also be really able to use the data and to find a model on sustainability early on, yeah, so that the observatories can remain and will be useful for healthcare and will be based in the local healthcare systems in a way that they do not, that they will not be closed down after the project ends. Yeah? And that's how H2O has been designed from the beginning. And I think we got very, very good expertise and insight also from the private side on how to do this, how to scale up. Yeah, we have, or sometimes I think we might be in science making things more complicated. Yeah, whereas people who have a more practical, or who see also more the business perspective, they have maybe a more practical approach to things, and also would have lots of good models how to scale things up. Yeah, and that's at least what I have learned in H2. Yeah,